With our zygomatic bones, there are two of them, so we have a left and a right, and these are commonly known as our cheekbones. And so here I am circling the zygomatic bones. Now there's three different processes that we have. Let's start with a temporal process. We have the temporal process of the zygomatic bone. And so this is going to be the projection that's pointed towards the temporal bone. Next, we have the frontal process of the zygomatic bone, and so that would be facing towards the frontal bone. And then lastly, there is the maxillary process of the zygomatic bone, and so the process that is going to face towards the maxilla. Our lacrimal bones, which there are two of these as well, are going to be behind the maxilla. So here what I'm circling in red, and you can't actually see it easily on this skull view, but you can see it at a close-up, okay? So the lacrimal bones are going to be part of the medial wall of each orbit, and there's a special feature that we find right here, and this is this lacrimal groove. And this is where our nasal lacrimal duct sits. So this is where our tears are going to drain. We have two nasal bones, and these are found medially within our skull. And so this forms the bridge of the nose and often can be fractured when there is a heavy blow to the nose, so such as getting hit by a baseball bat would break them. Again, there are two of them, so we do have a right and a left nasal bone. The vomer is a single unpaired bone that has a triangle shape to it. And here it will articulate with the maxilla down below here. Also, it will articulate with this purple bone of the sphenoid, and then as well as with the green bone of the ethmoid. And in this image below, this little point right here, if you can see it, there we go, that will be the vomer, and so you see it helps to make up then that nasal septum. The inferior nasal conchae bones are going to be paired bones where we have two of them, and these will help to create a turbulence within inhaled air so that our body is able to take that air in. And what it does is it helps to form that nasal cavity when we find it in this location. It will be the inferior and the lateral walls of that nasal cavity. And this is a parasagittal section of the skull. And so you can see it looks kind of like a conchae shell appearance to it. The palatine bones are going to be paired sets of bones that help to make up the hard palate. And here, these would be represented in the yellow. So the palatine bones have this distinct L shape to them, and they're part of the hard palate, the nasal cavity, as well as the eye orbit. So the horizontal plate will be right here. So they will be the smaller sets, and together this then will make up that hard palate of what we see then in this figure here. Our maxilla, or maxillae for plural, are made up of two bones. So we have a left and a right side. In these images is represented here by the orange. And these are commonly known as our upper jaw, and again, there is a left and a right side where they will unite to make then that upper jaw. And we find the maxilla to be at the central part of the facial skeleton. All right, so some areas that we have and some structures, we have the alveolar processes, and so this is the area that is going to house our teeth. Most of the hard palate is going to be formed by the maxilla, but remember the palatine bones in the yellow will also make up the hard palate as well. And then lastly, the maxilla have the maxillary sinuses, which we find here. And these are important because these help to lighten the skull, and so it's not so heavy, as well as humidifying and warming inhaled air for us. The mandible is an unpaired bone, so there is only one of them, and commonly known as our lower jaw. So the body of the mandible is going to be this horizontal portion that we see. The ramus then is going to be perpendicular, and it's going to be slightly at an angle. Then what we find on the ramus is the coronoid process, which the coronoid process then is going to be more anterior versus the mandibular condyle, which I'll do here in green, is going to be more posterior here. So the coronoid process, again, which was anterior, this is attachment site for muscles for chewing, for mastication, whereas the mandibular condyle is going to articulate with the temporal bone, helping to make that TMJ, temporal mandibular joint. Just like with the maxilla, the mandible also has these alveolar processes, which are for housing our teeth. Then we have two different foramen, which again, foramen means a hole. First, we have a mandibular foramen. So this will be found on the inside of our mandible. And this is for nerves and blood vessels for our lower teeth. Our mental foramen now is going to be on the outside portion of our mandible and has to do towards our chin, mental for the chin region. Thus, we'll have nerves and blood vessels going towards our chin. We have four sets of sinuses that are affiliated with the bone that they are found in. And the purpose of why we have sinuses is that they are air cavities that are lined with mucosa or that will form mucus. They help to lighten our skull so it's not so heavy. Also helps to humidify and warm air. So think about this, especially once we hit winter. We don't want that cold air to enter into our lungs. And so that helps to humidify that air that we have. Another purpose for it is that helps with the resonation of the chamber and give us our voice. And so for location, what we have is the frontal sinus, which is found within the frontal bone, the ethmoid sinus found in the ethmoid bone, the sphenoid sinus, which will be found medially, and then lastly, the maxillary sinus found in the maxillae. So a few other bones that we find around or within the skull include first the hyoid, and the hyoid is found at the base of the tongue, and it is the only bone that does not articulate with any other bone, and it has this classic horseshoe shape to it. We also have ear ossicles, which are found within our middle ear, where we have the malleus, the incus, and the stapes. And these three bones are the smallest bones within our human body.